We are back here on Carolina Women with our friends. Dr. B, great to see you. Miss Carla, as always, it's a treat to see you. And learn about the things that you do here. Again, we talked about it being magic and helping people with feel the best about themselves. And specifically, this machine is really more than just feeling good about yourself. It is actually helping helping acne. Let me just say it out loud, something that can be really difficult for some folks. And we're going to talk to you a little bit about your experience. But Dr. B, share with us a little bit about an Aviclear machine and what you do here.
Yes, it is life-changing. So it's the only FDA-cleared laser specifically for acne. It targets the sebaceous glands in your skin at the wavelength of 1726, which is specific for the sebaceous glands.
Interesting.
Yes.
Okay.
So instead of having to go through chemicals to treat acne, like your isotretinoin, Accutane, which is so toxic to your liver, and for females, you have to be on birth control pills because you can't get pregnant while you're taking it.
Okay.
So that just erases all of that. And here, you know, you can use Aviclear, and it has an excellent response rate. Yes.
Well, you were saying that it's very similar on the mechanism. It's destroying the sebaceous gland, which is really what the chemical medicine is doing, just with a laser.
It does, and then you do it with 3 treatments.
Okay, 3 treatments.
About 30 to 45 minutes long.
Okay.
About 4 weeks apart, and the response rate after 6 months is about 82%. In 12 months, 92% response rate.
And can an adolescent use this machine also?
Definitely.
Okay.
So if you're post-pubertal, you can use the device. You have to have post-puberty wherein you're not forming as much of the sebaceous glands anymore. So that's when we're doing it. 18 and above, sometimes 16 and 17-year-olds with the consent from their parents. We also do that as well. And
we were talking about men coming in as well as women, and I haven't forgotten about you. I definitely want a testimonial from you. But we were talking about not just face, but back, chest, other places that
yes, you call it your chest knee or your back knee.
Back knee, that makes sense. Okay.
Yeah, so we have a gentleman that I did on the Aviclear, wherein he was on testosterone, and he had just a breakout of acne on his chest and on his face, and we used this on him, and I just literally saw him a day ago, and there has been no recurrence. It's over a year now since we did the last treatment. Yes.
Do you mind sharing a little bit about your experience with this
Aviclear? Yeah, I mean, it's amazing. It really is. I really hope that it captures more people that are struggling with acne. There are so many, you know, high schoolers and even to myself, an adult female, that do struggle with this. So I think the beauty of it is that I know that I can do only 3 treatments, and these could be potentially 30 to 45 minutes. And in a year from now, I will not be going down this road and struggling. That to me is huge. I'm not having to do all the other things that you typically have to do when you're battling and you're walking in the journey of treating and correcting acne.
So where are you in your treatment regimen right now?
Yeah, so I'm using a very gentle skincare, and we do, when you do this treatment, we do a consult about skincare because that's so important to complement with this. So, you know, that is in between, but right now I'm on my last treatment is coming up in the week.
Okay.
And, you know, I will have a good result starting at 3 months after that. And I just can't wait to see that in those 3 months.
Carla's on her 3rd treatment.
Okay.
So she's had 2 treatments. And one thing that you expect is you'll have what you call purging.
Got it.
Wherein about 20 to 30% of patients will have acne that was going to come out right after the treatment for about a week or 2.
Makes
sense.
So
you expect that. So it's coming out and it's not coming back.
Okay. What are the durations between treatments?
About 4 to 6 weeks. So.
Okay, so 4 to 6 weeks, you let everything settle down and then you do it again. Do you consult with skincare, and then do you talk to the women about makeup and things like that also?
I mean, that is absolutely a good point, because there are several ingredients that, you know, we want to not use if we're acne prone. So our estheticians here, we certainly can go over any of that. We do tell you to bring a list or those products in and do a customized
I think
consult.
you should do. You did your cooking class. I think we should do one on acne. I've got 10 grandkids that would probably be thrilled.
Yeah.
Thank you for sharing your story. As always, Dr. B, thank you for sharing the incredible spa with us. Thank you all for joining us here on Carolina Women.